Hello, good afternoon, and welcome. I'm Dr. Gloria Kane, and I'm here with my amazing colleague, Dr. Mirang Liu, and we're with the Howard University School of Social Work. And so we would like to have a conversation with you this afternoon on, giving and the impact on mental health. And so we know that the COVID-19 pandemic has opened up the hearts and minds and philanthropic gestures, more than we've ever seen before. It's even made givers even stronger, and it's led individuals who may not have, been strong in their giving, to have a change of heart. So let's think about this phrase. Hang on for a second. And it's an old school thought, and it says, well, why do you have three cars, but you see your neighbor walking? And so we probably have experienced that. And we wonder, if, someone has, more than one car in their driveway and a neighbor, is out, doesn't have transportation, why doesn't the other neighbor have the heart to say, hey, well, I have three cars and you can use one of them? So as we move through, this conversation, kind of think about that and, let us know in the chat what your thoughts are. So we also know that, the research is emerging in terms of giving and generosity. I mean, it's being studied by our colleagues in economics, our colleagues that are in neuroscience, psychology, sociology, and ecology. And so in the field of economics, they look at, giving and generosity through patterns of, how people donate money. They look at how people create foundations. And in the field of neuroscience, they look at the impact of giving and how it has an effect on the brain. And in psychology, they look at giving in terms of, understanding the patterns of giving in terms of what triggers are present when people decide they want to give, and then what are those things that drive people to giving. And so, in the field of sociology, they aim to understand giving among groups of larger societies as well as organizations. And so Notre Dame University started the Science of Giving project, and they kind of wanted to understand, what are the mechanisms for, individuals and groups in terms of giving and in terms of different levels of generosity. And so they group giving into four different categories, one being charitable donations, the other being formal volunteering, the third being helping a stranger. And then the fourth category is caring for a spouse, a child, or a loved one. And so we know that with charitable donations, it occurs when there's a benefit from giving, or, it evolves out of a purpose. And so with formal volunteering, this occurs when an individual decides to give of their time and talents, and they don't expect to receive anything from it. And a lot of the time, some people feel as if their volunteering does not have purpose when people offer them, incentives or levels of compensation. And so the other category is, helping a stranger. Some people are led to, assist individuals that might be in need, maybe one point in time, or they might want to help someone and where they will not be identified or linked to that person, or their giving effort will not be linked to anything. And then in terms of caring for a spouse or caring for a loved one, we know that it's an innate part of giving, whether it's, intentional or not. And so how does, giving develop? How does, generosity develop? So we know that, generosity can be, a learned behavior. It can be a character trait. It can actually be an actual practice. It involves, giving to others, not simply just anything in abundance, but rather giving things, that are good for them and that have purpose. And so we also know that generosity, is a virtue, and, to practice it, it allows people to do good for others. We also know that it's necessary. And we also know that it helps one's own true and long time, purpose as well. And so, what do we gain from helping others? We know that you build a sense of community. We know that you fulfill a purpose. It's a sense of renewal, and it also provides, a sense of confidence. And so, these are just a few of the reasons or factors that explain why people give and explain why what people benefit from giving. All right. And then, the impact on giving in communities. We know that community giving, focuses on, collective happiness of the entire community. We know that it allows communities to thrive. We know that, it helps communities embed, their own resources. And it also promotes a sense of, positive reliance. And so some people give or are considered givers because it's all connected to altruism. And we know that with altruism, it's an unselfish regard, for the welfare of others. And so a lot of disciplines, have, professionals that are altruistic. And we know very well in our social work profession that a lot of social workers, may be altruistic and where they want to work in certain areas or certain practices, maybe because of their own lived experience or maybe because of the experience of, early volunteering in a certain area. We know that, some medical professionals are altruistic and they want to practice in certain medical sectors because of maybe some experience that they've had or maybe the experience of a loved one. And we also know that in the legal profession that some people that work in that sector are altruistic because they want to either help to advocate for social justice or work in the justice realm. And even in education, we know that some of those professionals are altruistic because they think about when they were in school themselves and they think about a teacher, a guidance counselor, or someone who was really helpful. And they decide that when, they're older and once they're established, that they want to give back, to either the school that they attended or they want to become, an educator. And then even in the field of counseling, we know that people can be altruistic and they want to help people because they may have experienced something themselves. And I really think about the substance use profession. There's a lot of people who may be working in that profession as counselors, or in some capacity may have their own lived experience, or they may have the experience of a family member or loved one that has suffered from substance misuse. And so, how do we build a generous and giving society? So, there are a couple of steps that are involved in doing that. And the first is, adapting and changing. And that means that, we have to think about how can, individuals, adapt to, a giving and to, a changing society. And we also have to, in step two, think about, engaging in socially responsible giving. Um, and then the third one is to, teach and educate, even as early as, school age children, about giving, about, generosity. And so it's not anything that happens overnight. It really takes time to build, a generous, and giving society. And so, and even more about, using a giving strategy. There are four steps that come to mind when building this concept. And so the first is R for relevance. Is this thing that I'm interested in, giving or volunteering or, providing, charitable services to, is it relevant? What's the mission of the organization? And, what type of impact, will this have on, the community? And then, even after I, give or after I make a donation or volunteer my time, is this sustainable? Will these services stop, if I'm no longer, giving or if I'm no longer, volunteering? So people want to know, if their efforts are, sustainable. And then just making sure that there's excellent in management of operations. We want to make sure that anything that you are donating your time to, donating your resources to, that they're going to be managed very well, and that they're going to be distributed equitably, so that your community or your agency or your organization benefits well. And so when we build a sense of giving, the very first thing that we have to think about, are we able to make, a commitment? Will this particular area that we're interested in giving to, will there be an opportunity to continue this? And do we have the bandwidth? And are we capable of, making, a commitment? And just expanding, your thoughts and your actions, outwardly, and then also looking around, in the community to see, what the needs are, and making sure that we don't judge people based on what they do, and making sure that we also don't judge others by what they're doing, and also just creating a sense of giving is also helpful. And so, additionally, when we're building, a sense of giving, there are four principles and aspects of charity, that we can apply. And the first is time. Do I realistically have time to, commit to an organization, to a purpose, to a charity? And also, like, what is the essence, of my giving? Does it have purpose? Am I just doing it because it looks like it's the right thing to do? It will help me with the promotion. It'll help me with my position in the community. Or is it really in my spirit, to give? And then in terms of talents, like, what talents do you have that may be a good fit for your community? Or what talent do you have that may be a good fit, for an organization? And then in terms of money, how much money are you able to commit? Are you able to donate without overextending yourself, or without sacrificing your own personal needs for the needs of the community? And so these are just some of the things that you have to think about. And giving is so multifactorial. There's no exact science to it. It's not a cookie cutter approach, but it is very broad, and is also based on the individual's spirit, the individual's purpose, the individual's sense, and the individual's resources. And you have to take all those things and see what would be a good fit for you to commit your time, your talents, your money, and all of this will drive your essence and also drive your spirit as well. Okay. And so now my colleague, Dr. Mirong Liu, will talk to you about, overextending yourselves. Like, what are the risks? Dr. Liu?
Thank you so much, Dr. Ken, for a wonderful start of the presentation. I really enjoyed, especially you start with why do I make my neighbor walk when I have three cars? That is really a vivid illustration.
Exactly.
To continue with Dr. Kane's intro explain dialogue,
Mhm.
I want to start with giving its particularly uh, heritage or tradition within the African American community. And we all know the saying, it takes a village to raise a child. And I recall there's a one study we conducted in Illinois examining the child care subsidies program, and we looking at the family relative care provision. And we found that many grandmothers, aunts are providing non-custodial care for their grandchildren, more than 8 hours, sometimes more than 8 hours a day. And we conduct a survey, and a majority, 90% of them were African American grandmothers. So we conduct a survey on examining what is the first three reasons that they would like to provide care for their grandchildren. And the most cited reason was for altruistic reasons. So they are just simply want to provide care for their children so that they can help their grown adult, their own children. And and then we provide policy suggestions that this altruistic motivation of providing care for grandchildren should be subsidized, especially for families in the low-income community. But then this follows with the line that you mentioned earlier that a lot of times giving is for altruistic reasons. And along the line, we all need to be aware of the risks of giving, especially when we are overextending ourselves, because the boundary is really difficult to draw, and the fulfillment and the altruistic motivation sometimes can be very powerful, very overwhelming, that we didn't even know that we are actually overextending ourselves. So, for example, this overextending ourselves can blur the boundaries and make it difficult to maintain a healthy balance between supporting our loved ones and preserving our own well-being. We may be overcommit of our time, energy, etc. And therefore, during the giving process, we need to establish clear boundaries to protect our own mental health and overall well-being and prevent ourselves from burning out. Second is it is crucial to give and offer support when we can. It is also equally important to empower and to take ownership of their own mental health journey. Overextending ourselves may unintentionally diminish others' own sense of agency and self-efficacy in managing their own well-being. Next slide. The risk of overextending also involves emotional burden. When we think about especially African American community, the impact of systematic racism, discrimination, socioeconomic disparities contributes to the disparities and unique challenges in mental health access and outcomes. And so when we overextend ourselves when giving, this burden can become overwhelming and impact our own mental health and overall well-being. The risk of overextending ourselves also including vicarious trauma. We had a wonderful doctoral student conduct a research on especially the vicarious trauma for social workers when they work with clients. That's a vivid example of how the risk of overextending ourselves can impact social work as a profession as well. So constantly witnessing and emphasizing with the struggles of others or our loved ones, particularly in the context of systematic racism, discrimination, can result in vicarious trauma. Also, cultural competence. One may not always have the same or similar lived experiences, even if we're from the same community. Such cultural understanding is nuanced, and overextending without being culturally competent can reinforce stereotypes and make assumptions and fail to grasp the nuances of others' experiences. Often, we see overextending ourselves leads to neglecting our own responsibilities and well-being. It is important to strike a balance between providing support and fulfill our own needs and commitment and self-care practices. I cannot help to share an example from this morning. One of my colleagues was helping community organization very altruistically, got out of the way to provide the support that he could, including changing for example, if you don't mind, I'll just give example. The over hours, extended hours of traveling, and extended hours of work. At the end, the lecture at the community organization was very successful. However, this colleague felt so fatigued and he lost his backpack on the way back, that including his work, schedule, etc. So and we were sharing the thoughts, and it can be make me relate at the topic we talk about today. That is, while giving, we have the risk of overextending ourselves, and neglecting our own responsibilities and well-being. And codependency and enabling. Overextending ourselves can create a codependent dynamic. This dynamic may enable unhealthy patterns of behavior and hinder others' growth and self-sufficiency. Also, overextending can lead to neglecting or underutilizing of other support systems are available. It is very important to encourage others or our loved ones to seek for professional help, engage with community resources, other support systems to build a strong, systematic support network. We emphasize a support network for individuals, especially for vulnerable communities, need to be systematic, integrative, including family members, neighbors, community organizations, as well as public policy sectors. So it's important that we encourage the loved ones or others to build a strong, systematic, integrative support system. So we would like to give examples of some strategies for support and empowerment. One way of providing support for the community is to promote literacy. For example, promote health and mental health literacy and education, and also promote financial literacy education with the community. So to encourage the community and individuals be self-sufficient and gain knowledge and improve the behavior, which leads to improved overall well-being. Advocate. It is important to advocate for culturally competent care and support systems. For example, culturally competent care in terms of mental health provision, providing trainings to develop a workforce of health providers that is culturally competent, and encourage community support networks and resources. We touched based on this in the previous slide. It is extremely important to explore and to build build the gap in the bridge to encourage individuals seek for community support and help the community to build support systems, networks, and explore and make utilization of the resources that is widely available. Highlight in terms of especially, for example, help in terms of mental health. It is important to highlight the significance of destigmatizing mental health through open conversation and storytelling. Such open conversation and storytelling can be very powerful, especially in the marginalized community, to express needs and share experiences and to encourage help-seeking behaviors. Also, it is important that we advocate for policy changes that address mental health disparities and improve access to care, because ultimately, we all function under the policy framework, and it's important that we advocate for policy changes to address systematic racism, address systematic discrimination, which is key factors to lead to stress trauma, um, which can negatively impact well-being. So therefore, it's extremely important to advocate for changes at the policy level to address these health disparities and improve service provision for marginalized communities.
Mhm. Thank you, Dr. Liu. And so, one of the things that I think about, especially in the African American community, given that a lot of areas are under resourced, and as you indicated, are marginalized. Sometimes it's hard, staying within the boundaries of giving because you want to give so much because you
Mhm.
know that there so many domains in the community that just have unmet needs, such as, housing, healthcare, educational equity, and then just access to quality, mental health services. And so, for a lot of people that are givers, sometimes it's difficult to, set boundaries or just say, look, I'm kind of maxed out, I can't do that. Or, I don't have access to these resources. I don't have access, to these particular services, that you might need. So I think that's something that we, have to think about, how to establish boundaries, how to set boundaries, and then being that we're givers, how to feel comfortable with it. Because as you just talked about these different, strategies for support and empowerment, we don't want to compromise our mental health because we don't have everything or have all that it takes, to give to the communities that we so passionately serve and that we, care about.
Yeah, exactly. Thank you
Mhm.
so much, Dr. Kane. I definitely echo with what you said because I think a lot of us struggle with this.
Mhm.
I think one idea come to mind is also as a giver, as helper ourselves, we also need to have our own help or
Mhm.
support system
Mhm. Absolutely.
that we can monitor ourselves. Hey, this is so much
Mhm.
you can do, and sometimes I think it's as one way of doing that is to make sure we have help or support systems, for ourselves, for social workers, for other health providers, that
Exactly.
we actually on top of self-care, we also care for each other and help to each other to set boundaries. Because I totally understand it's very difficult um, to keep in mind of the boundary not to overextend.
Exactly. Exactly. And so I remember one of the elders from my community used to always tell us that you're going to give somebody something. You're going to give them clothes. You're going to give them shoes. Don't give them clothes and shoes that you've used and that are run down because the next person that gets those clothes and gets those shoes, may need a fresh start. So
True.
I give them something that's already on the bottom.
Yeah.
So, it makes us think about how we, should give our best. If you're going to donate somebody a pair of shoes, make sure they're going to be able to keep them a couple more months and
Yeah.
not that they would try them on and have to throw them away, once they get home.
Yes. Exactly. That's a very good example. Um, I think especially difficult in the helping profession,
Mm-hmm.
health helping or social workers, social researchers, because for example, in terms of social work, the goal of the profession is to seek social justice and
Mm-hmm.
help marginalized community. So it's hard to separate our passion
Mm-hmm.
um, and set the boundaries. Hey, this is your this is your passion, but this is so far you can go without burning out yourself. Uh,
Exactly. Mm-hmm. And then, the other thing that I think about, especially for those of us that are in helping professions, is being able to establish boundaries between being altruistic
mhm,
and then being of service, to individuals, in the community.
mhm,
Because sometimes our passion blurs the reality that, you have to help this person how to operate in systems of care
mhm,
and in
mhm,
systems, of service. And for an example, I remember, um, a provider in a hospital was upset about a patient not getting, the proper treatment and medication for their substance use disorder. So they spent a lot of time, going from floor to floor, going from provider to provider, to make it happen when the person didn't realize that, they were in a different system of care, and just giving people what they wanted at that time may be detrimental to their health. So sometimes we have to be able to balance that altruism
Mm-hmm.
versus how to help people to function and manage,
Mm-hmm.
within systems, of care. And I think we're all passionate, about something, and it probably drives our life's work.
Yeah, yeah, exactly. I was reading the other line, and sometimes being overemphasized, sympathizing, and over compassionate can also um, be very difficult for the helping profession ourselves.
Mhm. Mhm.
And
Mhm.
it's so true.
Right.
There are research done on how like social workers burning out and
Mhm.
the vicarious trauma of, for example, the child welfare case workers.
Mhm.
Those are, and so there a level of awareness in the profession uh,
Mhm.
to make sure to address this secondary trauma uh,
Mhm.
and address social workers burning out. But I think we still have a greater levels of awareness need to raise.
Mhm. Exactly. Exactly. And something else that comes to mind is that, being a giver, as we know, in our field, it doesn't have to be, monetary. It doesn't have to be, giving things materially, but just being an advocate for social justice, is a form of giving. I've heard some people say, "Well, I've talked myself through this. I've talked, people through and through about a certain issue that I'm passionate about."
Mm-hmm.
And, I get to the point where I'm just tired of talking. And so sometimes when we get to that point where we're all talked out about something that we're passionate about, or, we've been meeting with people, we've been, having advocacy events, we've been going to health fairs, we've been going to, different types of events. Sometimes that's when the work really begins, when you're tired.
Mm-hmm.
And so giving doesn't always have to be, something tangible that you put in someone's hand, or those other types of things,
Mm-hmm.
as well. And I know that, here in the School of Social Work, we are very giving, especially to social justice.
Mm-hmm.
We advocate for social justice in all of the different domains that we teach in and that we're interested in. And so, some people might equate that, well, you give grades. It's like, no, we give skills, we give knowledge, and we give an education so that our students can go out here and change the world. As Howard University prepares social workers.
That is a really good point, Dr. Kane. When you think about that, that especially that what we are giving is to teach students, right, provide education, so
Hmm.
that provide knowledge
Hmm.
and training, so that they can be self-sufficient
Hmm.
uh, and grown to be professional ones and helping with the reach the goal of social justice. I think that's a great example how we give and then meanwhile we provide a network, a
Hmm.
task force who can
Absolutely.
give to the general society.
Absolutely. And, advocating for social justice, it doesn't cost you anything. Just to have a heart, to have a voice,
Passionate, yeah,
right, and to have purpose.
yeah, yeah,
Exactly.
yeah.
So someone indicated that they're not rich, but they enjoy sharing,
Hmm.
and so that's very important, as well. I often think about, people. One of the slides we talked about, helping a stranger
Hmm.
as a category of giving.
Hmm.
And, sometimes I think about, people you might be standing next to, you might be on the train with, or walk past,
Hmm.
might be $1 away from,
Hmm.
economic
Mhm.
economic calamity or
Mhm.
travesty.
Mhm.
And so, um, just knowing that that could potentially happen to someone, and you have $1 that may have an impact on the person's lifelong financial trajectory, is very concerning. I know myself, I wouldn't, feel comfortable if I knew someone was, a few dollars away from, losing their home, or, not being able to pay for transportation, pay for food. And sometimes, just those little things can really take people,
Mhm.
a long way.
Mhm.
So even if you don't have a lot of money, a dollar or two, might make the difference, in a family being able to eat, or someone being able to keep their home, or, just having shoes, on their feet.
Yeah, yeah, exactly.
Hmm.
Um, yeah, and that's kind of can relate me back to the survey that we did in Illinois. We
Hmm.
did back surveys for grandparents who are providing care for their low-income uh, uh, adult children to care
Hmm.
for grandchildren. And most of the grandparents, they were low-income household themselves as well. So I think it's really strong, and it is a family value, but it's also strong, um, altruistic motivation that
Hmm.
they would like to give their limited resources to help their adult children and to care for the grandchildren. And sometimes they are burdened by a lot of psychological stress themselves,
Hmm.
also from the care provision for grandchildren.
Hmm.
And that is really on that level. I think um, that is the level I think that we
Hmm.
advocate for policy makers
Sure.
to provide support for such caregiving giving.
Hmm. And then, so Dr. Lou, there are some people who are afraid of giving because they may have grown up without having, the essentials
Mhm.
or things that they need. And so once they become successful,
Mhm.
they're concerned about giving back, and they're concerned about, sharing, because that's the fear of losing it, all over again.
Mhm. Mhm.
So, one of the things that we have to do, if an individual wants to share, or, wants to be, supportive, is, to help them to explore those things that
Mhm.
they may be concerned about, towards helping them to develop, a sense of giving. And given what's going on with our economy and the different things, with the debt ceiling decision coming, very soon, a lot of people who may have been giving all this time may be concerned. I may have to slow down on my giving or my sharing, because I don't know what the future holds.
Mhm.
I don't know if this, new change in policy,
Mhm.
will have an impact on my ability to be supportive to things that I'm very, passionate about.
Yeah, I totally can agree with that. I think we have to. I think what I think right now is we have to respect where they're coming from,
Mm-hmm.
affirm what they're afraid of, or what the fear and feeling of that is. We have to affirm that feeling. At the same time, um, I think there are things that we can do. I think role examples, role models will be very helpful. I think there will be because um, I think people learn from other people's behavior patterns, and that the influence can be very powerful. So
Mm-hmm.
by giving support and giving warm, you know, emotion support for people like that, I think it may help them to think from a different perspective and may allow them to have the opportunity to share and to open up.
Mm-hmm.
Mhm.
Yeah, absolutely. Just kind of, meeting them where they are, which is something that we do very well,
Yeah,
in social work.
yeah,
Um, Yeah.
And then let me relate with our Howard University School Social with a Black perspective.
Mm-hmm.
Affirmation is one of the key principles of the Black perspective. I think that can be applied in this scenario that we affirm.
Right. Exactly. And just as I indicated earlier, the School of Social Work is giving in terms of social justice. The Black perspective is also giving too, because it allows us to, look at some of these dynamics, kind of frame them, within a sense of community, and understand that, giving may have been the only resource and the only vehicle that the Black community has had in terms of being able to, have the resources that we need, and also as a vehicle to promote change.
Exactly. Yeah.
Okay. So, just in summary, we just kind of want everyone to know that, giving varies. It's not one particular way or mode or method that you give. It's an individual choice. You can provide nourishment to someone's soul by giving. You can build community, increase happiness. And it's really, a process of, one step at a time. Okay. So, I'll let you just kind of talk about concluding thoughts.
Yeah, sure. Thank you. So in conclusion, we think giving and supporting others with challenges is very important. But it's important to be aware this should be done by setting boundaries and prioritizing our own well-being. Um, and collaborative support that encourage one's agency and utilize community resources and emphasize self-care is important, so that we can help others to foster resilience and improve the overall well-being.
Okay, thank you so much for bringing us to a close, Dr. Liu. And we want to thank all of our listeners, all throughout, the United States and abroad, for taking this time out to, listen to our talk and our conversation and discussion, on giving. And so we ask that you give back to us by completing the survey and letting us know how much, you enjoyed, our talk this afternoon. And we appreciate and look forward to your continued support for the Howard University School of Social Work, the home of the Black perspective and the home of social justice, as we seek to train and make students Howard prepared. Thank you.
Thank you. Thank you, Dr. King. It's been such a pleasure today to be here sharing with you about our results. And we thank you for your time. And
Yeah,
thank you for helping us complete the survey. And we look forward to sharing with you more things we know, our perspective in the future sessions.
all right. Thank you, Dr. Liu.